Good afternoon, everybody. Laura and I agreed that first I will give you a brief overview of Franka, and since my view is a professional's view, the mother's will follow. So, Franka's story. Tammi, Professor Katrin Õunap, forwarded to me an email by Franka's grandmother. She asked us to help her granddaughter first with a diagnosis and secondly, either with a treatment or possibly at least a referral. When I met Franka, her case history was as follows. The birth was entirely uncomplicated. During her first year of life, her motoric development was slightly slower, but not alarming. Later, however, she first started walking at the age of 2, and the first words she said were at the age of 1, but regressed and disappeared later. So when Franka reached us, she was 3 years old. She was able to say 3 words at that point, and the parents connected the regression to severe RSV bronchiolitis at the age of 11 months. Franka had been examined at the Tallinn Children's Hospital. Her head MRT suggested a possible variety of brain damage compatible with perinatal hypoxia. Franka and her parents had also seen a geneticist. Various metabolic tests were conducted. And the results were all negative. And the geneticist's summary at the time was that the patient, there is currently no basis to diagnose a genetic condition. We took over where the previous physicians left off. First, we found that Franka has a specific behavior pattern. I found I had noted it down in her case history because I found it surprising. I tried to mimic the movement pattern of her hands and found it difficult to mimic, to cross my third finger over the fourth and vice versa. What I noticed, however, was that Franka's muscle tone was relatively lower than a baseline child's, and the stereotypical movements of hands were quite characteristic. The EEG showed epileptic patterns, and all our support specialists said that unfortunately Franka's development is more than 1 year below the age-appropriate mark. Considering the severe RSV bronchiolitis, for a moment we hypothesized autoimmune encephalitis. However, MRT findings did not support this theory. We sequenced her gene panel. To my surprise, the result was also negative. I had been convinced that it would yield a Rett syndrome diagnosis. This negative result made me feel slightly helpless. I did not dare to admit this to Franka's parents, but we initiated anti-epileptic treatment because we knew 90% of patients with Rett syndrome will be suffering from epilepsy. Next, I saw Franka half a year later. At that time, she had developed additional Rett syndrome relevant idiopathies. The EEG showed a positive dynamic and the MRT findings no longer supported any kind of acquired issue. I decided to send the family back to the geneticists, and Dr. Pajusalu conducted a triectome test, finding a result that supported the clinical findings we had already noticed. Dr. Pajusalu later said that this is a possible course of diagnosis that can occur. Franka was diagnosed with Rett syndrome. It's prevalent in girls. Initially, the development is age-appropriate, then skills regress. As they get older, their breathing develops anomalies, bruxism, holding their breath, epilepsy, and later on in life, potentially arrhythmias. We agreed that Franka's mother will take it from here. What had them get in touch with us? What was their reaction to the diagnosis? And largely thanks to Franka's family and the strong support of the Children's Foundation, we have reached treatment. The treatment course has its pluses and its minuses. Franka's mother will tell us about them, as well as about why the parents can't be silent when they are raising a child with a rare disease.
Tema on Franka. Siin pildi peal on ta
15-aastane. He's 1.5 years old on the photo. She's 8 years old today. When Franka was roughly a year old, she was a perfectly regular baby, cheerful, curious, active. But at the age of about a year, everything changed. She was no longer interested in toys. She no longer used her hands purposefully. Her motoric skills regressed. She started wringing her hands and her fingers in strange ways. She did not start walking. She had weak muscle tone, hypermobile joints. And where Franka was previously cheerful, she started having meltdowns, crying fits. We didn't know what would cause those meltdowns in a generally cheerful child, and we didn't know how to manage them. So we started seeing various physicians and therapists. After a year of near daily visits to specialists, we read an epicrosis said she has developmental delays. But my mother's intuition told me there would be something else, because it seemed to me Franka was the only child in the world to wring her hands in this way, and nobody had been able to tell us why. And so Franka's grandmother knew some people and went to Tartu to ask for another opinion. Here's a photo from the endless hospital ways where we spent a lot of time with Franka.
Milline oli meie pere reaktsioon, kui saime teada Franka diagnoosi?
How did our family react when we found out the diagnosis?
Esmalt ükski vanem ei ole valmis sellist uudist vastu võtma ning ammugi ei teada, kuidas selle uudisega
No parent is ever ready to get this news, and nobody will teach us how to cope. Looking back, I see we processed this as in a relatively classic trauma arc. Shock, then denial, then thoughts about we can do it, it all will be fine, interspersed with moments of helplessness and grief.
Kõrval nii kummaline, kui see ka ei ole.
But strange as it may be,
Hetkel, kui Franka oli siis 3-aastane, kui me saime
when
diagnoosi.
at the moment we got the diagnosis, when Franka was 3, we felt peace.
Selle tõttu, et lõpuks oli meil vastus.
Finally, we had an answer. Finally, we knew what created all these problems, what had caused all our troubles. And I would like to massively thank the medical geneticist Sander Pajusalu, who during the deep pandemic period, we found out the results of the genetic test, when he online told us the diagnosis. He did it in an incredibly humane and delicate manner. He has my massive gratitude for this. This photo is intended to illustrate a moment soon after Franka was diagnosed. We were at a hike in the nature, and we were told to tie this red ribbon to a tree and make a wish. We still have this wish now, 5 years later. I believe I'm speaking for all parents of children with rare disease. The wish is for the child to be well. About our journey to the treatment. Let me come back to the year 2021, when we had just found out about the diagnosis and we returned to Tartu for clinical tests. We met you after, and Eve, you told me the Rett syndrome currently has no treatment. However, the medicine makes rapid advances. And I felt it was a lovely way for a treating physician to give comfort to a grieving parent. However, it only took 2 years until in the US the first Rett syndrome drug began to be marketed, debut. I remember this day clearly. It was the 11th of March, 2023. When I read the news on my phone, we took the photo. I put Franka in her bed to sleep. She was laughing as usual. Naturally, sleeping was the last thing she felt like doing. And I looked at her and said, Franka, do you know what an important moment this is? She didn't. But even so, this was the first time we felt hope for something that could turn the tide of the disease rather than manage the symptoms. And I know we were discussing at home the possibility of moving to the United States for the drug. But our family is here, we have another child as well. We have colleagues, we have friends, and we took this possibility off the table. And even if we had sold everything we owned, it wouldn't have covered the treatment for long. So the moment the news came out, we got in touch with a children's foundation, letting them know that we are interested in the drug if at all possible, and we submitted an application. And I know since this 11th of March 23, the Children's Foundation, our treating physicians at the Tartu University Hospital and the Rare Disease Competence Center have worked really hard on the case. We have been in constant touch. There has been a lot of work behind this treatment. The 3 years since the drug became available in general has been a long time because this disease takes its toll. But in last October, we were finally able to begin with the treatment. Franka and another 3 children were able to receive the drug. Improvements and drawbacks. Let me start with the downside. Currently, our main problem is constant diarrhea. We haven't yet found a solution. We have been seeing specialists about this, and I hope we'll be able to get it under control soon. Naturally, since Franka does not speak, and if a new situation presents itself or a new drug becomes available, I don't know, maybe she cries more. She cries more, and we're not able to tell whether this is caused by anything caused by the drug. And administering the drug is difficult as well. It has a very specific flavor and she has to take it mornings and evenings. She can tell when we've hidden it in some other food or drink. We try to find new ways to give it to her every day. But I think while the situation is new for all of us, the drug is new for Franka specifically. We all get used to it and it improves. What's positive though, Franka has, so to say, come out of her bubble a lot more. She's much more interested in what's surrounding us. She wants to be more involved in our daily activities. She makes more eye contact. She wrings her hands much less, and she uses her hands more than she used to. And the best for us is, while Franka's character is, as I said, she could switch from sunny to stormy in a heartbeat, I would say the frustration fits are nearly absent now, and she no longer needs screen time to calm down the way she did before. And what could be better for a parent than a calm and happy child? And why shouldn't parents hold their peace? Why shouldn't the parents stay silent or whisper when there's a child with a rare disease in the family?
Ma tean, et iga vanem kogeb ja protsessib
I know every
seda
parent
teekonda väga erineval.
experiences and parses the journey
Minu kogemus
differently.
on see, et nii kaua, kuni mul oli
My
siis
experience
süütunne
was that as long as I felt guilt,
ja ka lein, siis nii
shame,
kaua vaikisin.
and
Aga
grief,
ma sain üsna kiiresti
I
aru,
stayed
et
silent. But I realized quite quickly
ja meie lapsed.
that a rare disease is not
Ehk siis
a thing to be
meie
ashamed of,
räägime
and our child is
väärikalt.
not a matter of shame. If we speak openly with dignity, our other children, our family, our acquaintances, our friends will see that this is something to be spoken about openly. If we don't speak about it, we don't get help, there will be no awareness, and processes will not adapt. I believe we have to be the voice of our child, because the child has no voice. And finally, from my experience, the moment you start sharing, you start speaking, then saying it out loud feels like therapy. Sharing heals you as a parent also. Thank you.
Aitäh teile. On küsimusi saalist?
Right. Any questions? Audience? We got one question online. Dr. Eve Õiglane-Šlik, what do you think? Do you think the treatment path of diagnosis and treatment path of patients with a right diagnosis is well organized? It's hard to say. Ultimately, each patient has their own disease and experiences it in a slightly different way. We try to track the situation and see the patients at least annually, but a lot depends on the new problems developing. Say, patients with epilepsy who require anti-epileptics, control and so on, see us more frequently. But we see Franka maybe annually, maybe twice a year, because thankfully Franka does not experience any major side afflictions. And I genuinely respect and admire parents who are able to manage their children. And forgive me, but the attitude of the parent towards their child, even towards a child with a disorder, is unfortunately always reflected in the face of the child. Another question: how long do the other 8 children with Rett syndrome have to wait for treatment? Will it ever come to them? People in the audience, there are people in the audience who will be able to better respond. Thank you. Laura Tamm, rare disease parent, Eve Õiglane-Šlik, physician.